Hello and welcome to lecture on hematuria. That is the second most common presentation in urology clinic after the colic pain. So most focus on this lecture will be the approach to hematuria. What is hematuria and what could be the differential diagnosis of hematuria? Here we see that what is hematuria. Actually, hematuria is when we see blood in urine, that is uh, hematuria. That could be the macroscopic hematuria or gross uh, hematuria. In macroscopic hematuria, we have few red blood cells that are seen in the HPF, like there is high resolution, and the 3 to 5 RBCs are normal, but more than 3 or 5 that are abnormal. And in gross hematuria, that is visible in the urine. The patient will complain that he or she have blood clots or blood while maturation. So, what are the differential diagnoses of hematuria? We can see the most common is UTI. That could be the cystitis, pyelonephritis, and other some renal cancers, like there could be kidney tumors, or in the tumors that could be in the bladder. And the renal calculi or nephrolithiasis, that is the kidney stone, that also cause the hematuria. And the prostate cancer, that can also cause the bleeding that could be present in the urine. So the BPH, that is the hyperplasia of prostate, that cause the hematuria while maturation. So how can we approach? This is the most important topic in urology, or it also could be nephrology. Hematuria, actually, the presence of blood in urine. So first we do the urine microscopy and do the culture. If there is positive urine microscopy and culture, we treat the underlying infection. That we treat the if there is cystitis or pyelonephritis or urethritis. We like treat accordingly. When there is negative urine microscopy and culture, like there's no bacteria in the urine, we go and do the CT intravenous pyelogram or ultrasound urine cytology. It means we do the imaging, also this cytology, that why or is there any obstruction, fistula, because there could be the obstruction due to stones like this. Then we do the refer to the urologist. First, these are done in the nephrology or general clinics. The ureteric or renal stones, when seen in on imaging, we manage conservatively, like we will do the lithotomy, or if the stone size is less, we do the oral therapy. But if there is signs like sepsis or large renal or ureteric stone or renal impairment or some other complications, we do manage and remove the kidney instantly, because we have to prevent further complications. Sometimes urethral malignancies like cancers, uh, then we have to also refer to the urologist, because they do investigation by putting cystoscope, like with the endoscope. We do the investigations of the bladder, then the ureters, then the kidney, by the help of endoscope. So in benign conditions like benign prostatic hypertrophy or strictures, that for example, the strictures are present, for example, in the bladder, we have a fistula. Bladder may have be punctured because of fracture of the pelvic bones, but this is not more common. So we also refer for the endoscopic investigation and treatment in BPH. For example, we do the endoscope through the rectum to see the prostate, that is there hyperplasia or is there any adenoma or tumors. So we check completely of the prostate uh, to rule out the hematuria. So thank you and see you in next lectures.